Nigeria has the second highest burden of stunted children globally, with a national prevalence rate of 32% of children under 5. An estimated 2 million children in Nigeria suffer from severe acute malnutrition (SAM), but only 2 out of every 10 children affected are currently reached with treatment. According to Nigeria Demographic and Health Survey 2018, in Niger State alone, 28% of children under 5 years of age are stunted, 14.4% are wasted, and 4.7% are underweight. To confront this challenge, Plan International is implementing the World Bank and Global Financing Facility-funded Accelerating Nutrition Results in Nigeria project, which aims to increase the utilization of quality, cost-effective nutrition services for pregnant women, lactating mothers, adolescent girls, and children under 5 years of age in 12 local government areas in Niger State.
Plan got involved in the nutrition and food security and nutrition response in Niger State as part of our contribution to responding to the malnutrition crisis in Nigeria, where we have one of the worst cases of malnutrition across the world. As we have it now in Nigeria, there are over 14 million children who are acutely malnourished. And what that translates to is about 2 out of every 5 children are acutely malnourished, which means they will either die before their 5th birthdays or will not grow to achieve their full potential. So we had an opportunity to work alongside the World Bank, and this is our own contribution.
The ANRIN project combines behavioral change communication with the delivery of a basic package of nutrition services at the community level, contributing to the SDG Goal 2, which is to end all forms of malnutrition.
So far, so good. ANRIN is accelerating nutrition result in Nigeria has come to stay, and we started the project since 2017, and it has made a lot of improvement and towards improving the nutritional status of women and children in the state. Plan Internationals are also engaged the services of community volunteers. These community volunteers have been given stipend, which also is a stimulus to their own economy, because we have a lot of youths that are not employed. So we engage these people to carry out these activities at the community level. For ANRIN PIU, we are not taking Plan International as an NGO again. They were taken as part of the PIU, because we work together. So with that, there's a serious, very good collaboration between Plan International and the Niger State government.
Plan Ganga ya taimake ni sosai, kuma a yanda ta kan zo ta ba mu magungunan nan na bashi, gaskiya yana ci abinci sosai, kuma wallahi ba wani zazzabi haka.
Maganin nan da Hwati take kawowa, muna so ta ci gabawa maganin nan, don maganin nan wala yana taimake mu ga jikinmu gaba ɗaya da yaranmu.
Ni da kaina nake bin su gida-gida. Da wajen MY in mun haɗa su wajen counseling inga, so za mu educate nasu akan muhimmancin abinci mai kyau zuwa antenatal da shan magunguna da ake basu. Sai da yaro wata 6, sannan kuma yadda za su breastfeed nashi a cikin wa'annan counseling din.
Ibrahim Fatima is one out of 540 health volunteers trained by Plan International to provide a basic package of nutrition services ranging from maternal, infant, and young child nutrition counseling, intermittent preventive treatment of malaria in pregnancy, vitamin A supplementation, deworming, iron folic acid, ORS, zinc administration, in addition to commodity management and healthcare waste management across the 12 intervention LGAs in Niger State.
Koyarsu wanda na samu a wurin training din da shine na fara aiki, ina raba magunguna, kuma gaskiya ya taimake mu saboda yaran da ba su da isasshen lafiya da na zo na fara sai ya sa wa'yansunsu gaskiya sun fara living da kyau.
Through household visit for service delivery, community health volunteers carry out targeted constant visits to provide a basic package of nutrition services to pregnant women and lactating mothers, adolescent mothers, and children under 5 years old.
Our women and the children are really benefiting in this program. As of before, our children are dying because of malnutrition and other problems. But now, we really appreciate them as the way they handle the program.
An samu ci gaba ne gaskiya zuwan da ake yi ana ba mu magani ana kula da mu. Saboda kowane magani aka ba mu muna jin daɗi a kan shi.
Da farko da zan fara wanga aikin na ɗan ji shakku wanda zan je in tunkari mutane a lokacin ana cikin matsacin bandits kuma mutane na tunanin yaya za a yi making a samu zaman lafiya. Na ɗan try best ina na ɗan je na zauna da mutane so na ɗan fara sanar da su. To at the end of the day mutane suka fahimci abin da na zo da shi. Wasu na kira na masu gani ana male champion, wasu ce doctor baka kawo mana magani ba, doctor baka shigo angonmu ba. So na ji daɗi sosai a wannan lokacin.
Plan is working hand in hand with the Niger State government, building the capacity of the stakeholders, particularly the government, relevant government ministries and departments that we are working with. So we see this as one of our sustainability strategy. Another sustainability strategy is working with the local NGOs in Niger State, so that knowledge and practice can be sustained even after the end of the project.
Among these beneficiaries, over 10% of them are adolescents women. They are more vulnerable. I mean, looking at their age group, and we have over 10% of them, and we are still looking out for more of them, just to ensure that the intervention is inclusive. And apart from the women and children that have benefited from this program, I want to mention the fact that their households have indirectly benefited from the program. We have, in the course of our intervention, trained over 500 community health volunteers.
We are grateful to Plan International for bringing this project to Niger. It is evidence-based, not by mere selection, because we are aware that a survey was conducted, and it is the result of that survey that showed gaps, nutritional gaps, in these vulnerable groups, the so-called marginalized vulnerable groups, which are usually women, and children, especially those under 5. So I must tell you that it is widely accepted.
Kafin zuwan ANRIN, lallai kan akwai matsaloli na game da maganan malnutrition, amma yanzu saboda zuwan wannan ANRIN din da kuma yanayin da aka kwashi yaranmu suna bi gida-gida, suna bin angwanne suna faɗakar da mutane, kuma ana ba da magunguna don su samu ƙosasshen lafiya. Gaskiya an samu ci gaba sosai a ta wannan fannin.
The project has so far provided a basic package of nutrition services to 184,940 children under 5 years of age, 116,096 women, out of which 12,096 are adolescent mothers. The project is also rapidly influencing positive behavior and practices to change gender norms and transform power relations in favor of women and girls through care group engagement sessions across the state.